I would just like to thank you, one, for joining us today, Tamberly Conway, Dr. Tamberly Conway, if I'm not mistaken. If you can just start out giving us a little brief background and tell me a little bit about who you are and where you got there, and we'll get right into the interview.
Thank you so much, Beth. It's just an honor to be here with you today. I appreciate the invitation. And I'm just fascinated with the work in which y'all are engaged. And I sense how deeply connected the work I'm doing now is linking to that. But my background is, I was telling you a little bit earlier, I had kind of an adventurous part of my youth, and I had lived in Key West, Florida, for about 4 months, and suddenly found an opportunity to jump on a sailboat and sail to Guatemala. It was actually a pirate ship, and I jumped ship there, and that's where like a lot of my interest in culture and people and travel and forests actually came into play. And my background is in primarily wildlife management with my bachelor's degree. And then I left and went to live in Guatemala because I did fall in love with the language, the culture, the people, and really began the community engagement aspects of my work and my career there. And then upon returning to the US in 2001, I really found like this deep connection to the Latino community. And I began to work in a state park as a law enforcement officer, a firearms instructor, and then a manager, and realized we didn't have spaces and places really for Latinos and the more of the large groups that were coming in those spaces. And so that actually drove me to return for my master's degree in forestry, and with a focus on forest recreation management and really defining spaces that would be more amenable and more accessible to large extended family groups. And that flipped me into my doctorate, where I worked on, again, in forestry, but this time with a focus on human dimensions and natural resources at Stephen F. Austin State University, a university really well rounded in their College of Forestry and Agriculture. And that's when I dove deep into community engagement with my dissertation of creating a mobile outreach and information station and a bilingual outreach team. It was called the Bosque Mobile, or the Forest Mobile. And we assessed the program and really started to define what was important to Latino communities in terms of conservation, and found just an array of things that were really important to people. And so that really drove me into the Forest Service, where they were actually covering the cost of my research. And then they invited me. I mean, literally, I got a tap on the shoulder from leadership, and I turned and they said, "Would you be interested in coming aboard with the Forest Service?" And I remember the people at the table were sitting with me, and when that leader walked away, they said, "Do you realize just what happened? That never happens." And so I joined the Forest Service and worked full time for the Forest Service while pursuing my doctorate and helping to better understand the values, the needs of Latino community and conservation, and the important aspects that we bring to community engagement. So that is my background. I was with the Forest Service for 12 years and decided to jump ship, kind of like I did in Guatemala. And and that has changed the trajectory of my work in founding a small business, a small women-owned business, Conservation Connections. And so now I'm moving forward into that mycelial realm.
But that rolls right into my first question. You kind of already touched on it. I feel like how you went from the Forest Service to founding the Conservation Connections and becoming a certified forest therapy guide. But how did that actually happen? And what kind of steered you towards becoming the forest therapy guide? Because that's obviously kind of a long way away from being a Leo for the Forest Service. We're kind of on two different spectrums on that. So just kind of wanting to learn more about that transition.
Yeah, so it's a great question. And what happened was I was working with the Forest Service. And when I came in, it was in conservation education and with a great focus on community engagement, especially with Latino audiences because of my background and my passion of working there. And I was first in Texas. And then when I graduated with my doctorate, I had signed on the dotted line to go wherever they wanted me to go, and that was Washington D.C. So here was country girl come to big town, and but my director called and we had met because she was the one that funded my research, and she said, "I want you to come to Washington D.C. and work under my directorate in conservation ed." And so I remember being terrified going to DC. I go and just became pretty rooted pretty quickly. It's a really wonderful place, lots of green space, lots of, not just Latino, but diverse communities. And so it really linked with my passion. And and during that time there, I was already doing a lot of work in health and nature connections, because again, that's like it's something that people can really, it's a universal concept. My health, my children's health, my community's health, etc. And so during that time, it was all about education. And oftentimes we educate people, but then, you know, you don't see them really connecting. So about 2 years prior to my departure from the Forest Service, I was listening to Dr. Kathleen Wolfe at a presentation in Washington, D.C., and she's one of my research superheroes working on urban greening and health benefits. And so she mentioned forest bathing and forest therapy in 2 slides. And afterwards, I went up to her, I was like, "What is this?" And she said, "Oh, I think there's an organization here that does that." So that night, I went online, started looking, found 2 guides in DC. And I reached out to both of them. One responded. The next weekend, I was on a forest therapy walk in a very urban park in Georgetown. And I thought, "Oh, I should have done this before. I'm a nature girl. I teach conservation education, and it was a 3 hour walk. I'm like, what are we going to do in 3 hours? We get out there, and by 20 minutes, in 20 minutes, I realized, oh my God, I've never done this before. And what happened, it was a series of invitations. It's very invitational, open sensory. And it's a standard sequence that guides use in this way of like connecting people to nature in a very profound way. Or for me, it was that first time. I immediately went to my director and said, "I think we're missing something. And I think this is it, that I really feel like this practice could be something that could help us to really deeply connect people to the natural world." So she ended up agreeing to send me to California for the training. It was a 1 week training and then a 6 month of kind of internship kind of practice and or mentor practice. And so she paid for half of my training and half of my travel, and I paid the other half. So I was invested. And so I became trained while I was with the Forest Service. And then I was able to, bring the work forward internally. But we were under, an administration at the time that really was not allowing, that type of work to move forward. And so I decided to leave. And very amicably, I mean, literally the day I left, I went up and hugged our chief, Vicki Christensen, and she was like, "You go do this health and nature work." She was like behind me 100%. And so I fledged the Forest Service nest and still have this incredible network of Forest Service family. And I've been working kind of from the outside in. And so working with domestic and international programs to really bring the work forward through conservation connections and continuing to pulse this out nationally and internationally. So it's been a great journey so far, and it continues to be so.
That's great. That's awesome. That's a really cool story. And great to have that kind of support at your work on your career path and supporting what your chosen path is. That doesn't always happen. So that's fantastic. Well, you kind of already answered the second question a little bit that I had for you. So you talked earlier about the partnership with the Latino organization. I think it was Mobile Forest. I can't remember the name right now. But you've mentioned in your bio and talking to you, creating traditional and non-traditional partnerships in conservation, and definitely community engagement is huge driver for you. Is there one specific, and maybe it's the one you mentioned earlier, collaboration that stands out? And why does it stand out to you and the impact it's had on you personally?
So even prior to becoming a guide, I was in Texas at the time as a Forest Service employee, but we started to partner with a doctor, Dr. Dan Porter, and Texas Forest Service. John Warner was an urban district forester, and in a small, like just, I mean, like a green space right outside of Houston. And so everybody knew it as kind of, the green jewel. And they managed red cockaded woodpecker. They were always looking for ways to tie people to the forest. And so John had a great idea of connecting with this local community health center that primarily served underserved communities. And so we started a relationship there, and again, bringing in the health and well-being connected to nature. It really like makes the light bulb go off with people and saying, oh, so when I'm in nature, then I'm also receiving health benefits. And so that became, a real interest and passion of mine. And then shortly after, when I went to Washington, D.C. to serve there in the headquarters in the Conservation Ed program, I had the honor of meeting Dr. Robert Czar. And he and Dr. Porter knew one another because they were writing nature prescriptions. And Dr. Czar is the founder of Park RX America. And I saw him speak, oddly enough, at an International Society of Arboriculture conference. And so I'm like, there are all these interconnections, with trees and forest and nature. And so I approached him. That week, and about a month later, we brought him on board as an official Forest Service partner in the Washington, D.C. office in the conservation education program, because I approached my director again and said, look, this is a very non-traditional partnership because we're going to be able to link to an entire network of, at the time, I think he had about probably 400 healthcare professionals, counselors, even some school nurses, people in his profession. He was or is a pediatrician. And so, linking with this type of network, helping that network understand the value of nature connection, and kind of pulsing out our own messages and language. So we developed this partnership with them. And then actually around that time is when I became a forest therapy guide. And it actually inspired him to become a forest therapy guide, a certified guide with a Association of Nature and Forest Therapy. And so we started doing all sorts of, community-based events, both on national forest lands and in urban settings. And it really helped to spark and ignite this, new opportunity. And at the time, I would pick on him because, they would talk about parks. I'm like, you need to speak the love language of the Forest Service, which is forest. And I said, when you're in a park, you're in an urban forest. So just,
Right.
trying to shift language. And we really started to talk a lot about, and I introduced him to Kathy Wolf, who does the urban greening and nature connection. And so I think he really started to see the power of nearby nature connection. And that was around the time I left the Forest Service. And what happened in the world? Our mandatory pause, and he and I started talking about how to continue to bring the work forward. And so actually, forest therapy guys around the world started bringing forest therapy to people around the world in a virtual setting, just like this in Zoom. And sometimes people would not leave their homes, so they were connecting with a plant or a fish tank, their fish in the fish tank, or just being able to look out of their window and noticing, the nature connection. And then he started actually writing prescriptions for nearby nature, to go lie in your hammock for 20 minutes at a time, to sit on your stoop or your balcony or just look out of a window. So there began to be these interconnects of like, nature is everywhere. You don't have to go to a forest. You don't have to go to a park. And so that non-traditional partnership has budded and blossomed, and now, is leading into work in which he and I just submitted a grant proposal for an urban and community forestry grant here in Texas. So the cool thing is that this isn't just for patients. What he has identified is that, our healthcare providers throughout that mandatory pause, we all realize they're all superheroes and they are all like experiencing major stress, anxiety, increased suicide rates. And so his mission has been recently to help healthcare providers connect to nature in different ways, and forest therapy being one of them. So one of our dear friends, Paola Silva, guided some of his healthcare provider kind of cohort members of the Park Rex America in Houston, and that turned into now a submission where we're searching for the opportunity to integrate forest therapy with healing of people and also the healing of nature, or creating urban forests. So the idea is for them to be able to plant some of the trees, nurture trees around the centro de corazon, and actually help them to understand that when you're nurturing these trees in the urban forest, you're nurturing yourself. And so it's this form of reciprocity. And so, a long time, we've known one another now for about 8 years, and it's all coming back around to utilize a practice to heal both people and the land, and to heal, the caregivers and healthcare professionals that nurture people every day, but often don't nurture themselves. So learning how to nurture ourselves so that we are stronger to be able to nurture others and the land that serves us every day.
Perfect. That was an awesome story, by the way. I love it. You keep referring back to all of your career got started based on dealing with the Latino community and different diverse communities. So what challenges, not only kind of engaging with these communities, have you faced, but also just promoting forest therapy in general, have you faced? And kind of what is your way around it, or what do you feel should be your way around it? I know that kind of sounds almost like a job interview question, but I think it's important for everyone to understand, like, it's great that people may have these ideas and have these things, but there are challenges always. And so kind of just talk a little bit about those, if you don't mind.
Absolutely. Yeah. I mean, I think when I left the Forest Service, again, I was leaving the golden handcuffs, and and doing something that was kind of out of my realm. I've never been an entrepreneur before. And so it was just kind of diving into something that I was passionate about. And I thought, yes, I can work to bring this forward. And so there have been challenges and struggles, especially with the onset of our mandatory pause in the world, of going, like, how can we bring this to people and help them to understand the value it's bringing to them, in terms of nearby nature connection, et cetera. And so, often whenever I talk about, well, number one, I'm here in like the Lubbock area, we don't have many trees or forests. And so when I talk about forest therapy, they look at my third eye, they're like, what? And we do have forests, we have urban forests, but, nature and forest therapy, sometimes the connotation of therapy, that's why sometimes I say therapeutic nature and forest immersion, or forest and nature healing. I mean, forest bathing. The audience is an important aspect. Speaking to the audience in a way that it resonates with them. Then often I get, oh, well, I do that all the time. I go out in the forest and I'm always doing forest therapy. So sometimes I feel like it's people thinking, how are you going to bring value to me by leading me into somewhere that I go all the time? And so my response to them is that I felt the same way until I had that experience. After 20 minutes, I realized being guided in to a space allows you to get out of here and into your heart, into your body. Once you're there, it's a remembering of your body, and your heart and your spirit actually remember the deep connection that you hold with the natural world, because we are nature, we're a part of nature. And not every day we're removing ourselves from it. We're uprooting ourselves. We're sitting behind a screen. We're driving in our box to work. well, sometimes we are at work at home, but we spend 90% of our time indoors. We
You
should, as
know,
humans, be spending 100% of our time outdoors and connected to that from which we arise.
and not to, and I totally just interrupted you. My apologies. You just kind of triggered a thought in my head where you were talking about being behind a screen. And, there's this freedom that people think that they get from working remotely. But, there is that missing that actual getting out and commuting to the office actually gets you outside, where you just walk from one room to the other in your house. You're missing that 20 to 30 minutes where you might even have the windows down in your car because it's a beautiful day, or that engagement of just being outside. And someone who works remotely, I do have to step outside a couple of times a day and sit on my porch just to actually breathe outdoor air and be outside. And I didn't realize how much I missed that driving little aspect of it. So
Yeah. No,
sorry
I
to
mean, it's an
totally.
excellent, no, it's a beautiful point. I thank you for bringing it up because now, again, doctors and researchers are saying, the new sitting is smoking. And so you need to get up like every hour and go for a little walk outside. You need 120 minutes per week as a nature dose. Even if you get that 20 minutes here, 30 minutes there, 10 minutes, wherever you can. But just stepping out, looking up at the trees, at the fractal patterns around the ground and the grass. I mean, nature is one big fractal pattern, kind of collage. And that helps to reboot your neurological system. Just noticing, the sensory engagement, like noticing the breeze on your skin or the sunlight, and closing your eyes and cupping your ears to hear the sounds, that are close and even far away. All of that, like it's like that attention restoration theory of, oh, now you can get back to where you were instead of just getting bogged down right into work. And so it like actually restores you. And so bringing, I mean, you asked how we can expand this. It's by science and the knowledge that is arising, and a lot of it happened through COVID and the mandatory pause of researchers around the world. Some of my dear friends in South Korea who have brought this work to the forefront, along with Japan and many other countries now. But they've done an incredible amount of research about how nature and especially forest connection is so powerful, because when we go out under trees, they are emitting phytoncides, which are volatile chemicals being emitted by trees. It's actually like their immune system. And so when they're being attacked by an insect, a pest, a disease, a fungi, they will emit these phytoncides. But what the Japanese and the Koreans found is that, these are actually boosting our immune systems. They're reducing our cortisol levels, so reducing stress that's connected to all chronic disease. And then also, these phytoncides increase our natural killer cells, which really fight off cancer and other autoimmune diseases. And just even a 2-hour time frame in nature, and which is generally the time frame of a nature and forest immersion therapeutic experience, generally 2 to 3 hours is what we like to do in terms of these experiences. That elevates your natural killer cells and lowers your cortisol levels for up to 3 weeks in your system. So, you're getting a really powerful nature dose whenever you do like the 2-hour time frame that can last in your system. So being able to utilize, the science behind it has helped people to go, oh, maybe I should, and, incorporate some of these things into my own life. Because what happens when we guide people, they start to notice things they can bring back home. They notice, oh, I can maybe guide myself in this invitation. Is it the same? It's not the same, or can I go to a local forest and just go for a walk and stop? You mentioned your significant other on the Appalachian Trail and taking off in the morning just to be alone and be in that space, to be and to be present, because when people are hiking, they're hiking and they're walking past everything that has a calling, right? And just to stop and notice the little bee like rolling around in the pollen and just like getting covered up, you know, I mean, you just start to go, oh, wow, look at the work it's doing and how it's connected to me. And so you start to notice yourself as a smaller part of the whole. And so I think that is, one way that we're helping people to understand the value of the practice we're bringing. And it's hard for guides sometimes to value what they're doing, um, because it's not just a simple scenario, it's a guided practice. I mean, we've been trained and there are other trainings. I'm not saying ANFT is the sole one. And then when it comes to the diverse community, one thing that happened while I was with the Forest Service is, I wanted to see what would be the best mechanism to really bring the practice into the audiences that we are trying to serve. And so the idea came about to, well, how about train people from these communities so that they can bring the practice to their own communities and kind of like link a cultural aspect to that work and also bring it bilingually, right? And I'm bilingual, but still for me to go into a bilingual community, Spanish speaking community, I'm not going to necessarily connect at the deeper level that someone from their community would. And so I approached again I had some great directors. So I approached my director and said, look, um, basically this is my last hurrah with the Forest Service. She knew I was leaving, I had already announced it. But she was still very supportive. I said, I wonder if we could hold a training for bilingual individuals. Not everyone was Latino or Latina, but and could we hold it in El Yunque National Forest in Puerto Rico, because they had had a Hurricane Maria almost 2 years prior, and there was a lot of healing to happen there in that country, or in Puerto Rico, in our country, in US, but in that space. And so she said, well, go to talk to the forest supervisor. If she agrees that you can bring this training there, then I'll fund it. So I went to Puerto Rico, I spoke with the forest supervisor, and whenever I explained forest therapy and what it is and what it does, and she said, well, Tamberly, this sounds a little woo-woo, but right now the people and the land need healing, so let's go for it. It's just all about it.
There you go.
So
You can't
we,
ask her. Yeah.
yeah. So it was the first ANFT cohort that was like a specialized cohort, and so they agreed to, have it in. It was more of a bilingual fashion, because not everyone spoke full English or full Spanish. And um, so we brought it forward really, for this healing and for trauma recovery. We didn't really integrate anything in terms of trauma recovery other than the stories of the people who were attending. There were 22 attendees, 15 ended up graduating. Now 8 of them were from Puerto Rico, and they're still bringing this practice into their own communities there. And actually, some of those individuals went back to, say, California was one of them, where they had massive wildfires, and so they were actually guiding. There was another one who was actually going through a cancer journey during her time in the 6-month training, and she rang the bell, towards the end of her training, and so a lot of being cancer free. And so now she brings this to cancer thrivers and survivors and their families. So there were a lot of reasons why different people came, and a lot of it was associated with mental health, trauma recovery, and again, the connection with self and then one another in community, and then also with the land. And so, as I've watched people bring this practice in their own communities, it's been really powerful. And I've seen them change, in their own, more of like their own mental, physical, and emotional well-being, and the relationships they hold with their families. And now it empowers them to be community leaders in stewardship. And so one of my dear friends, Raquel Pinto, she has such a powerful personal story, of becoming a certified forest therapy guide and how that has created a ripple effect in our own community. And so it's these types of stories that, and seeing my own personal transformation and the transformation of others, I realize how important and powerful the practice is. And then we hear it all the time, with immigrant communities who feel unrooted from their places that they come from, and they're here in the US, and they're having a hard time rerouting, culturally, so many issues and that they face on a daily basis. And so forest therapy has helped them to feel more rooted. They often will make note of their grandmothers and their memories of, being up in a mango tree. And so it's like the forest therapy practice helps to reignite, the memory, which really do link to your neurological health and well-being. And so having that as a practice that help people to understand the value of getting out in nearby nature every day to support your mental and emotional well-being, and even beyond that, your spiritual well-being. And so right now, again, we're working on a remotely guided forest therapy research project with Dr. Kathleen Wolfe and Dr. Dorothy Ives from William and Mary, and Dr. Kathleen Wolfe is from the University of Washington. And so we're guiding this remotely guided practice with Latino community members around the nation to see if this is something that provides accessibility to the practice and helps them in their own, connectedness and rerootedness and mental and emotional well-being. So it continues to ripple out.
Oh, that's great. I'm gonna have to try some forest therapy. I've never had it, so I'll definitely have to do that. I mean, aside from my own just being in the forest, but not actually being guided. So now I'm very, 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 I was intrigued before, but now I'm even more intrigued. So you're doing a great job. And then I just have one final question for you. One, you can tell your passion is obviously there, and others have seen it. You've gotten several high recognitions and honors, including the Forest Service's Engaging Urban America Award and the USDA Secretary of Agriculture's Lincoln Award for Diversity and Outreach, if I can remember. Having that experience, being recognized nationally, internationally, what advice would you give to someone else who's aspiring to make kind of a similar impact on conservation, community empowerment, and just public health in general overall?
Well, I feel that community and really, creating those connections with others who bring a diverse thought and values and experiences to the table. So inviting, including, and involving people from our stakeholders from those communities at the very beginning, because so often all of these, projects and programs, they begin, and then maybe a little before midway point, they'll invite the communities who are really the ones that are being impacted. They'll invite them in to then become a part of the process. And so I just really feel like my research told me that, how important it is to bring people in from the get-go. And then just making sure that there are really powerful opportunities for people to be at the table and to have that interdependence with one another, because the interdependence part is so important. We bring our own perspectives to the table, and if we don't have all of those varying perspectives, then we're not going to get that rich outcome that we're really seeking. And people will realize, like, oh, this is an organization or an agency or whatever that's just trying to impose something, right? Instead of opening the door to become an equal partner in these efforts. And I think, one thing that we often notice is that when people become a part of this, and some of the youth who were involved in these both of those awards, they were the ones actually receiving the award. They were the ones on the ground. And to have these young people who were experiencing real mental health issues in terms of them, even some were suicidal, and then suddenly becoming a part of something greater than them, in terms of like an urban gardening project. And I remember one said, "Oh, I planted a seed and watched it grow." And I would go out every day and just marvel over this other being that I had, helped to create. And that young man became like the leader of of this whole program. And
Wow.
to watch him grow, and to watch the seed, and then watch the compost, and watch the mycelium as they reach out and support one another like the mother tree. I mean, it's just like the peer to peer concept is so important. We were planting trees at three schools, but not just at the schools, but among the community, within the community. And so these young people were just pulsing out their passion and their excitement and the education to other community members. And there was a real intergenerational component, because our elders know so much, and sometimes they're just not valued. And so to see the value that would arise in them when they noticed that they were sharing, their knowledge and their backgrounds. And so many of them had huertas, which were like small kind of food forests, and we were creating a food forest concept. So they got it, right? Like there was this interconnection of, yeah, I've done this throughout my life. My grandparents did this, and now we're seeing it happen in this community by the youth who are propelling the effort. But the intergenerational connections, were just so incredible. So having the unity it is just really vibrant. That's such an important aspect. And then the resourcefulness, because it allows you to seek different resources in the community, and allows you to understand the power of saying, I don't know, but somebody else out here does. And so being resourceful and how you connect with others. And then really like getting back to that deep sense of gratitude for what the earth, our mother nature, gives us each and every day. And then being grateful for how that leads to contribution. Because that, one of the reasons the food forest concept worked so well, we were trying to tell people, oh, it's important to plant trees so you can have urban tree canopy, and this helps with health and well-being, and reduce stormwater runoff, and all of the ecosystem services. But it went like this, like it just didn't matter until they were like, oh, we're planting fruit trees. That gives us fruit, the fruits of our labor. Oh, and it's providing all these other ecosystem services, maybe not to the highest level, like, the shade trees but ultimately they started working on a project with Texas A&M University related just to that, like the more ecosystem services and benefits of using iTree, and some of the other ways that we can identify the great value that trees bring us. But it goes so much deeper. Trees and forests they bring us so much more, and we're just touching the surface. And that's where I think forest therapy, or the therapeutic nature and forest immersion, can help us to really understand the true intrinsic value that come to us each and every day from not just the trees or our forests, but the more than human world that surrounds us. We become partners. It's becoming partners with the more than human world in how we move forward in the future, and becoming advocates of our own nearby nature, our own space, becoming conservation leaders in our communities. And then that pulses out, around how we see a global impact. And that then starts to create how we move forward in the world as individuals, and creating local, and then community, and then global impacts.